Hello, welcome to Wondermous. My name is Merikay Hunt, and I am the host of this podcast, A Leadership Journey. Today, I have Scott Neeley with you. He's the president and the CEO of Dignity Health Sierra Nevada Memorial Hospital, and he has some inspirational wisdom to share with us. So, kick us off, Scott. Tell us what inspired you to start your healthcare leadership journey.
To start my healthcare leadership journey, I suppose there's, what initially inspired me to start it, and then what got me to really invest. Because, quite frankly, as I look back, maybe 30 years, I think a lot of what initially got me to start it was, kind of ego-driven.
Okay.
And I think what got me to stay was actually finding the meaning and the fulfillment in the work, and that came later. That came in really understanding the potential for making a difference in people's lives, and kind of discovering the feeling, the sense of worth, fulfillment that came with that understanding. So, I started off as a smart kid, but kind of an ego-driven, arrogant, I would say, not
Thank you
particularly
for your
wise,
transparency.
not particularly wise young man, and I wouldn't claim any sort of a corner on the wisdom market, but it has been a journey, I think, of probably little by little incorporating some humility into my my being and my daily work, and also really, again, finding the fulfillment from making a difference in people's lives.
So, can you think of a pivotal moment? I like to call them aha moments when I'm working with individuals and groups on their professional walk. But can you think of an aha moment when you transition from that ego to that purpose and to really that making a difference?
I can think of several. I know that one that began to sort of steer my ship in a little bit different direction was um, a patient story.
Mm,
One of the things that I did along the way was some work on safety around blood transfusion. And
okay.
it's perhaps not so much the specific topic of safety around blood transfusion, but just sort of getting an idea of what it was going to take to um, really kind of stand up for something that I thought was important and to make a difference for patients. It turns out that transfusions aren't always that great of an idea. And
Hmm.
one of the things that we've done in medicine over the last, I would say, 20 years is gone to a practice of a lot less transfusion and really only doing it when it's necessary. Uh,
Mm-hmm.
and that's because about 25 years ago, a groundbreaking study came out that suggested that critically ill patients actually did better when they got far fewer transfusions than
Oh, wow.
was the practice at the time. And
Right.
I've been in practice long enough to kind of see that transition. And there was a time when I was working as an ICU doctor, and I went out to one of the floors in the hospital, non-ICU floors, to take care of a patient who was in severe difficulty, who was
Mm-hmm.
in distress and having trouble breathing. And to make a very long story short, uh, as it turned out, this relatively young man with a lot of medical problems, kidney disease and vascular disease, had received 2 units of blood that were unnecessary uh,
Mm.
that morning, and he was having a very, very severe pulmonary complication. He was unable to breathe because of a reaction to that transfusion.
Mm-hmm.
And I did what I needed to do as an ICU doctor, which was to put a breathing tube down his throat and to put him on a ventilator, a breathing machine, and to stabilize him. It took several hours. And fortunately, he lived, but he ended up staying in the hospital for an extra 3 weeks
Mm.
after coming close to dying.
Wow.
And it just impacted me because up to that time in my career, uh, I oftentimes had not been willing to have those difficult conversations with my colleagues, uh,
Mm.
to to say, we really don't need to do this, or the evidence doesn't support doing this, and that was a way of just sort of taking an easier road and not causing any friction with people who, after all, were referring uh, patients to me.
Sure.
And at that point in time, I just said, we've got to do something different. And that was actually a change in direction for me. I became really deeply involved in the patient safety movement. After that,
Mm-hmm.
I actually led an initiative of that at that hospital that became very well known in Illinois 20 years ago, but where we massively reduced the number of transfusions that we were giving to people. And subsequent to that, I moved to California, where I got another bite at the apple and actually led a similar initiative for an entire health system that resulted in a reduction in our use of blood transfusions by about 20,000 units a year. And that wasn't the only quality initiative that I've worked on, but it was one where I made a conscious decision to really try to find the path of doing the right thing for people, uh,
Mm-hmm.
and making sure that our patients were always getting care that was based on science and the best knowledge that we had, and finding a way to collaborate and to work with my colleagues uh, in a way that we really were always focusing on doing the right thing for the patients. That's been challenging at times in medicine, but I think we've gotten better at that.
Mm-hmm.
And that particular instance, that patient that I took care of,
I
really
love.
sort of marked a turn towards a different way of doing business for me, and I would
Sure.
say had a lot to do with me ending up being asked to take on, another leadership role and another leadership role. So that's a moment I will always remember.
Well, and I think what's inspiring to me about that story is two levels. Obviously, you possessed the confidence in what you do as a provider, but to have the courage to have the conversation, the fierce conversation or the crucial conversation, and then to continue on this road of collaboration, because oftentimes providers can be alienated when they're trying to do things that are not in flow with normal protocol.
Yeah.
And for you, you managed to win friends and influence people, Dale Carnegie, and continue to excel in that. So have you had a leadership in your walk that really inspired you, that you really learned from as you built your career?
You, like a mentor?
Yeah.
Yeah, I've had several. I've been really blessed with several wonderful mentors. I'll just name one. I was the chief medical officer at a hospital in Stockton, California, for a number of years, St. Joseph's Medical Center, and I had the privilege there to work with a CEO by the name of Don Wiley, and Don's kind of legendary in Dignity Health. I think he served as the CEO in Stockton for uh, uh, well over 20 years. It may have been closer to 25. I know he actually worked at that hospital for 30 years. Uh,
Mm.
and I think I think that I learned a lot of things from Don. I watched him always uh, manage and to work with a great deal of dignity himself,
Mm,
and to give that to other people.
mm.
And he was he is still around. Uh, he's retired now, but he is an incredibly bright and insightful guy. But he always brought a lot of humility to his work,
Mm,
and a lot of curiosity, and a lot of appreciation for other people's ideas. And I think the other thing that I learned from Don, sometimes rather difficult lessons for me, but I learned um, a lot about uh, focusing on relationships with
mm,
people that I was working with,
mm.
and kind of not necessarily always having to go to the mat uh, about something that I believed in, even if I was quite passionate about it, but
Sure.
to find the ways of connecting and building rapport, and um, trying to have influence as much through connection and respect for the other individual as through that sort of passionate uh, battering ram that I've been quite capable of of being throughout my career.
I shared with a class once, I said, we all know people that brighten the room by leaving. Let's not be one of them. Because the idea is when we walk into a room, no matter what level of our position in the organization, we want people to feel safe to share or to feel safe to challenge or
Right.
communicate their ideas. Because that's truly what collaboration is about. I mean, we might
Right.
not always agree, but we can at least ideate and explore. And I think from my history of being director of patient and family experience at a hospital, it's comforting and it's relieving to hear more leaders committed to creating that positive patient
Mhm.
experience. So, talk about some things about your organization now that really highlights that and focuses on that priority.
Sure. Well, it's interesting. I got into the role of CEO through a somewhat atypical pathway, and that is that I was a really dedicated quality and patient safety leader.
Mm,
Um, and that is not always something that translates into operational skill. But
mm-hmm.
in my case, I was able to sort of bridge that divide and to make it work.
Well, and I think one of the things that's powerful is, and shared this on a couple other episodes. I'd love to see more physicians in leadership roles in lots of sectors because I do think that they bring a depth and a breadth of experience, and especially if they've got the communication skills that can really help build the bridges and open up dialogues. That's when we can make positive and purposeful
Yeah.
change.
We're not necessarily born with those skills, but in
But
in
you've
any
been you've been coachable, Scott.
um uh, uh yeah, so getting back to that thread, um I think that a couple of things have helped me to be successful in this latest role. Bringing my safety and quality background and my real passion for that, but along the way I became uh, quite familiar with and a good user of the high reliability organizing approach to
Okay.
patient safety. And one of the things that you realize about high reliability organizing, or HRO, as you learn more and more about it, is that it's simply not merely a patient safety operational tool, but it is a tool that can help you in operations, period, which makes a lot of sense since it really came from observations of industries like chemical engineering and nuclear power and uh, um, commercial aviation and even military aviation, where there is tremendous operational complexity, but where organizations actually operate with far fewer dangerous incidents than you would expect based on the operational complexity. And so you can literally use this tool as kind of your blueprint for management, and that has worked really well for us as we've simply tried to have one operating system for our team. And I think that the other thing that we talk a lot about as a team is the fact that our intention is to deliver care that, in a technical sense, is always safe and of the highest quality that's based on evidence, but it's
Right.
also delivered with love for the people that we care for. And I think it's really appropriate to
So I
love
have to ask,
for what you're doing.
absolutely. Speaking of the word love, do you buy into the philosophy that the team needs to take care of each other and then that has the impact on the patient experience?
Absolutely.
Okay, good. Because
Absolutely.
when I first started in business, it was always about the patient and the customer coming first. But
Mhm.
then the team wasn't treating each other well, and I'm like, let's switch that. Let's have the
Yeah.
team treat each other well,
Yeah.
and then the patient gets to benefit from the harmony that's happening.
Yeah.
Um,
I,
so
I would
just
I would say there's a lot of subtlety to that
mm,
because uh, you know it's an absolute necessity to treat people with respect and dignity,
mhm,
and we're here for a purpose.
yes,
So when you talk, for example, about psychological safety and promoting a culture where people feel safe speaking up, where people feel cared for, where people know
right,
that they're going to be treated fairly, that's an important part of it, but it's not an anything goes, sort of cater to everybody's uh,
sure,
every whim sort of culture. It's a culture where people are treated with respect. They have the tools to do their job. They can speak up without fear of any kind of negative reprisal, and there
yes,
are expectations. There are, you know, guardrails because we
mhm,
all treat each other with respect,
right.
and we all listen to each other. So,
Mm.
so I'm absolutely determined to create a culture where people, feel that dignity and respect, and we're here with a purpose,
Mhm.
and we're here to do work. And so, finding that balance of, respect and psychological safety, but also we're here for a job, we're here for a purpose, and there's got to be accountability. I think it's a delicate balance, but I agree with you that people need to understand that they are respected for who they are,
Mhm.
that every single individual has basic human dignity, and I also think they need to realize we're here for a job, and there are expectations when people's lives depend on you.
Absolutely. So speak to that passion and that purpose of this wellness initiative. Share with our audience a little bit about that.
Mm. Um, a couple of years ago, maybe a year and a half ago, I was up here in Nevada County uh, in a community forum, and I had been kind of a student uh, of whole person care, of wellness, um, and doing a lot of work on my own on just understanding some of the really interesting things that are happening. For example, in the areas of trauma and understanding the biological basis of uh, disease risk increasing as a result of trauma, things of that nature.
Mm-hmm.
There's just some fascinating science going on in that area. But I got a question from the audience. They said, you've painted a really challenging picture in terms of the reimbursement that the hospital is getting, the fact that government reimbursement seems to be a tougher game every year, the cost of actually delivering healthcare going up all the time. What's the solution? And I looked at the guy and I said, I really don't know, to be quite honest. I mean, I know what the reimbursement horizon looks like, and it's incredibly challenging. And I know what labor costs. I know what pharmaceuticals cost.
Right.
I've got a pretty good idea of what the cost structure looks like in running a hospital and delivering acute care, and it's a tough game. And I said, the only thing I can really come up with is we've got to keep people healthier so that they don't have quite as much demand for acute care. And I don't know if I quite said that in jest, but I began to really think about that because anybody in my position who's done acute care in a hospital for a long time knows that a relatively small fraction of our patients get about 80% of the care because they have multiple chronic illnesses, oftentimes chronic illnesses as well as mental health issues, and we can all see that there is a real opportunity to help people live healthier lives, essentially through modifying behavior. One of the facts that we talk about, and it's kind of a stunning fact to many people when they first hear it, is that any given individual, on average, their lifetime health outcome is only about 20% dependent on the care that they get from the traditional medical system.
Wow.
Now, that's not to say that's not important. I mean,
Sure.
I had life-saving surgery last year, so I don't
Oh,
I
well, then
don't
I'm glad that you could be on my show. I didn't know that.
I don't minimize I don't minimize what we do here because it's truly miraculous for people.
Right.
But that being said, most of our health outcomes, say we all would like to not only live a long life, but to have our functional status, our ability to care for ourselves, to interact with others, to enjoy our families, to enjoy our loved ones, kind of a long life with, sort of a short end, as opposed
Right.
to, a longest life with a long period of disability or chronic illness. We'd certainly like the former rather than the latter. But increasingly, Americans, on average, are living more of their lives with serious chronic illness or disability. And so the healthy life, the health span, your years of good health and good functional status have actually decreased on average in the United States, as things like obesity, type 2 diabetes, other types of chronic illnesses have actually sort of taken a bigger chunk out of our lives. There's a real opportunity to improve that health span, for many different people. And so
And dealing with chronic stress too.
Oh,
I mean,
yeah.
there's that
No,
creates.
there's 8 things that, if you manage to incorporate into your daily life, will put years on your life. Obviously people know about the incredible beneficial impact of exercise, proper sleep.
Hydration.
Most folks probably don't know yet, anyway, that every serving of ultra processed food that they eat on average during a day increases their risk of developing dementia and other types of neurodegenerative disease. You know,
Yes.
most people probably don't realize that having, childhood trauma or other forms of severe toxic stress, spousal abuse, for example, actually increase their risk of dying of cardiovascular disease
Mm.
prematurely or of getting cancer. So,
Wow. Is
you
it
know,
because it's initiating that fight or flight response continuously?
it's because stress has an impact on our immune system. It has
Mm.
an impact on our cardiovascular system. It has an impact on our ability to recover from stress
Mm.
and to recover from, severe challenging episodes in life. It decreases our resilience. So,
Wow.
there are a variety of things that people can do in order to impact not only their life expectancy but really how well they live, and those include those physical things that we were talking about, but
Mm.
actually it's kind of more of a threefold thing. I think there's how we interact, how these mind bodies of our interact with the physical world, and that's
Mhm.
food and sleep and shelter and exercise. But there's also how these mind bodies interact, in terms of our spiritual beings, because
Mm.
people who get up every day and live with purpose live longer. I mean, that's
Mm.
I'm not saying that as conjecture. I'm saying
Sure.
that because it's been studied.
Mm.
Living with purpose, living with compassion, uh, uh, engaging in
Gandhi, Nelson
engaging
Mandela.
engaging in healing practices is not only
Mm.
good in terms of your
Mm.
existential being, but it's actually good in terms of your physical health. And then, the third area is social, because
Mhm.
we've many of us have heard that statistic that loneliness is as bad as smoking a pack of cigarettes a day,
Mm.
which in terms of life expectancy seems to be the case. But people who have, better developed social networks, people who have
Mhm.
healthy relationships, actually live healthier and more productive lives. And
Mm.
that again is based on large population studies. Now, developing causal links in areas like this is challenging, but it's very clear that uh, in addition to all of those kind of lifestyle factors that we can do in terms of our diet and exercise and so forth, that uh, paying attention to our whole beings, uh,
Mm.
and the fact
Whole
that,
being wellness.
yeah,
That's what
whole
just
being
came to me when
wellness,
you
that
said that.
that that's a great thing, right? And that extends beyond our physical practices to, who we are as heartfelt spiritual beings, who we are as social beings. All of those things add up to
Mm.
not just, as I said, sort of, uh, uh, existential fodder for life, but truly they add up to more and better years for people. So
Wow.
we want to take that on in Nevada County. We're standing up an organization and searching for partners who are kind of like-minded, who want to help people to both adopt this understanding and this approach, and also to have the tools. And whether
Mm.
that's, walking paths between our two towns here so that folks actually have a safe place to walk or bike if they decide to use that way of getting around rather than a car to go shopping.
Sure.
Um, that we encourage uh, gathering places and sort of engineer our built environment to
Mm.
support social connection and meaningful interactions with our friends and loved ones and neighbors, and obviously things like healthy food, whole
Sure.
food, um, and uh, avoidance of toxins. Let's just say, um,
And toxic people too. Can we add that to the list?
well, we have to have a place of compassion for toxic people. Right.
All right, I'll give him a little bit of grace.
Now, you know what? Ram Dass is very famous for having put, I don't know if you know, I'm sure you know who Ram Dass is, but he was a wonderful spiritual teacher. He's very famous for having put a picture of Nixon on the top of his mantle, so he could, he could continuously take in the teaching that these difficult people are
Mm.
great teachers, and that having compassion for them is important. And I think towards the end of his life, Rahm swapped out Nixon for Donald.
Oh
And
my.
so, um, but you know, uh, it's a great point that you just helped me make. Uh, those people are suffering too.
Absolutely. So in your journey, and my favorite question that will come in for a landing on, if you could talk to your younger self and give your younger self some words of wisdom, what would you say?
I would I would say that you have to gain some insight into your own emotions and where they come from.
Mm,
Sometimes they come from very, very distant, remote places in your life, but you've got to learn how to recognize them and to use them in a beneficial way rather than allow them to be hindrances, because I think many of us, we're hindered in our personal lives and our careers and so forth because of an inability to constructively modulate our emotions uh,
mm,
and to kind of be the people that we really want to be. So, that's number one. Number two, I would say you got to figure out what you love about other people,
mm,
um, and um, to foster that curiosity. Uh, I'm talking about things that have been big challenges for me. So
oh,
the last thing that I would
spoken
say,
from the heart
yeah,
too.
the last thing that I would say is um, you have to. I would have told myself, you really have to focus on what's fulfilling for you, what
Mm,
creates meaning, and you have to focus on that because you get one shot at it, and
mm,
um, the old saying, nobody ever wishes they had worked later nights. Uh,
mm.
um, uh, figure out what's fulfilling. My journey's been one of going from being fairly ego and career driven towards being very much driven by what's fulfilling for me and what makes a difference in other people's lives, and I would have liked to have started sooner, but it's been okay.
Absolutely. Well, Scott, it's been an honor to listen to your purpose and your passion driven life and to celebrate the wonderful leadership initiatives that you have in your organization. So thank you for being with us today.
Oh, thank you very much. It's been a pleasure.
Again, this is Merikay Hunt of the Wondermous Podcast, a healthcare leadership journey. We hope that you'll reach out if you or your team needs guidance, needs assistance to go to the next level. Remember to make every day count.